Good morning, everyone, and you're all very welcome to this event this morning to launch this report that has been, I suppose, in the makings for the last year and a half between CDI and the HSE within Health and Wellbeing and Age-Friendly Ireland. Just some housekeeping before we commence. So this is a hybrid event, so we have people joining us online. You're all very welcome. And then we have a small in-house group here this morning of around 20 people. For those of you in-house, the fire exit is at the back of the building, and in the very unlikely event of anything happening, we exit there and we all meet at the front of the house, okay? The front of the main house. So good morning, and as I said, we're here to launch this really, really fantastic resource in partnership with Age-Friendly Ireland. And the collaboration and the partnership that we have had with all of the partners around the table with this working group has been such a learning curve for all of us. And I think that's really important as we move forward in terms of what it is that we can all learn. And it's, you know, Ireland has come through a very tough time in the last 2 years, as has the world. And it's so heartening to see in this report the incredible initiatives that happened right across the length and breadth of the country to support older people to age well and to stay well within themselves in line with the Healthy Ireland Keeping Well programme. So we're delighted to be launching the programme. One of the learnings for myself was I had a great conversation with Sarah McCormick the other day, and she said this phrase to me that I'd never heard before, and the phrase was lifestyle medicine. And I thought, that's genius. You know, so we think of, you know, a lot of us tend to think with older people, you know, as people are, you know, aging and becoming frail, that they're on all of these medications and they have all of these comorbidities and all of these chronic conditions, you know, and, you know, there is all of, obviously, the therapeutics that go with that. But lifestyle medicine is such an important part of how all of us stay well, and how we also look at the personal responsibility of all of us as individuals to look at our own lifestyle and look at the things that we can do. And I was thinking, wouldn't it be great to bottle lifestyle medicine? And this document actually is a compendium for all of us of lifestyle medicine that we can all look at and see the things that happened in Kildare and in Donegal and Sligo, and let's take it and replicate it right across the system. I have apologies for people this morning that I must mention. So Colm Henry, unfortunately, was unable to make it this morning, and Sandra Toohey and Jeanette Dwyer from Older Persons, unfortunately, were unable to join us as well due to prior commitments. So I'm going to rock on because I'm the Master of Ceremonies. People aren't here to listen to me. So first of all, I'd like to call on Dr. Siobhan Ní Riain, who is the HSE's National Lead for Integrated Care, to make some remarks. Thank you, Siobhan.
So thanks very much, and it's absolutely, I think this is the first thing I've been at in person since the ending of restrictions. It's really lovely to be here. And just to let you know, I'm here on behalf of Colm, so I was asked by Colm and his office to come along and represent him at this meeting, and just to say a few words. So as we all know, back in March of 2020, we started to introduce restrictions on the activities of older people, particularly those in nursing homes in the early stages, and very quickly on those living in their own homes, as a means of trying to protect them from the awfulness of the virus and the awfulness of what we were seeing coming from Italy. And I have to say I was very involved in that myself in the early stages, having started on the National Public Health Emergency team actually just a couple of weeks after starting this particular job. So it was a very challenging and difficult time. In my own background, I've spent a lot of time working in the nursing home sector, so I know, and I knew from many colleagues, the devastation that this virus was having when it went in and killed up to 40 or 50% of people living in nursing homes, and staff to this day haven't fully recovered from that. So that has been very difficult. But an unintended consequence of protecting people and looking at and advising them to isolate or cocoon has, of course, been the effect on their mental and physical health. And on behalf of the Older Persons Programme, Siobhan Kennelly did a bit of work on the impact of cocooning measures on older people, which was published in the summer of 2020, and which informed the thinking of the National Public Health Emergency team when we went into the second lockdown. Advice on bubbles, on ensuring that people did have social contact and people that they met with. So as a follow-on from that particular document of Siobhan's, who's unfortunately left us, but remains in contact and a great friend and colleague, Dr. Colm Henry himself commissioned this document, which was really looking at a joint work between clinical design and innovation, and between health and wellbeing, and between multiple other agencies, including Age-Friendly Ireland, on what was available for people what was available for people in the community, within a focus on older people. So as I say, this document was commissioned by Cullum and was aimed really at looking at and evaluating the resources that are already in place for people in the area, in areas around the country. It provided robust information for the development of an online repository of resources for older people on a county-by-county basis. So in many ways, it's a legacy document because it describes what happened and what was passed. One of the beautiful things about this document, which I was reading last night, is not just the focus on what was done and the robust evaluation process, but the focus on the actual people it affected. So there are many quotes in the document. I can't really think of all of them, but there was one of them that said, "Cocooning, not marooning." I thought that was beautiful. Zoom is great, but I'm glad it's over. How many of us have felt like that? Many of us. But I can't imagine life without Zoom. Another great one. A couple of other quotes that really would bring tears to your eyes, I have to say. People saying, "My son did the shopping first," and it makes you realise how important family is. We had to stop going to the shops when restrictions were introduced. But as a follow-on from all of that, we've heard stories from around the country where local pharmacists have picked up their phone to their neighbours and said, "What can I drop over to you? What do you need? Do you want a bottle of milk on the way over?" So there are marvellous stories from around Ireland where people have been supported, older people have been supported by their community. So this document in many ways captures that, and it captures the resources that are available. I think all of us hope that we'll never get back to having to go through what we went through in the last 2 years, and certainly that older people won't have to be isolated in the way that they were. And that's how things are looking at the moment. I think people feel very positive, and I have to say, having been at the last NEFIT, the mood was very positive that we would never go back to something like this unless there's a drastic change. So that is good news. Another thing about the document that I think is really important is the focus on holistic care, health and well-being. So, we were very focused on and preoccupied with preventing people from getting the virus, but this document focuses on the importance of good mental health, which is something I believe in strongly from my own background as a psychiatrist, but also on good physical health and on the fact that both of those things are interconnected. So to me, this document represents what true integration is about. It's a collaboration across HSE, it's a collaboration across other organisations, Age Friendly Ireland, and other organisations for other older persons representatives. So what I want to do on behalf of Cullum is to thank the National Integrated Programme for Older Persons, to thank Health and Wellbeing and Strategy in the HSE, Age Friendly Ireland, and other older persons reps who were involved. I also particularly want to note of thanks to Stephanie O'Keefe, who was formerly National Director for Health and Wellbeing and who was very enthusiastic about this project when Cullum went to set it up. There were lots of members of the working group. Particularly want to thank Siobhan Kennelly, I've mentioned her, Sarah McCormack from Healthy Ireland and Wellbeing, and Des Mulligan from the NICPOC programme. Also, I can't go without mentioning Catherine McGuigan and her team for their significant contribution. So this is a document that shows what integration is about, that shows what looking at people holistically is all about. I think it's a wonderful legacy, and certainly I'm going to treasure it, and I'm absolutely delighted to have been asked to open here today. Thank you very much.
Thank you very much for those comments, Siobhan. So our next speaker this morning is going to be the Chief Executive of Meath County Council. So Meath County Council hosts the shared service that is Age Friendly Ireland. And really, if we think about collaboration and we think about, how we as a HSE move towards population health and looking at the needs of local populations and how we deliver services on that basis, local authorities do this all the time. That's how they deliver their services, and there's such learning there. And it's a really important relationship for all of us, at every level within the HSE, to have that relationship with the local authorities. So I really want to reference the fact that this was very much a collaboration with every local authority around the country, the Age Friendly programme within those local authorities, and the Age Friendly programme who then engaged with the older people in their area to hear what their views were. So Jackie, can you please come to the podium? Thank you.
Thank you, Des. Good morning, everybody, and particularly to those online. I hope a lot of my colleagues are there looking in, but it's great to actually see people and to be here at a live event. I think Siobhan said, I think it's my first one since we've opened up. We've had done a few, but I think we've been actually nearly talking to ourselves at some of the other ones sitting in departments. But look, I'm particularly pleased to be here today as I very much welcome the partnership between the Health Service Executive and the local government sector. And that is predominantly through, I suppose, the Age-Friendly Ireland Shared Service, and Des has outlined what that really is. But as Chief Executive of Meath County Council, we host the National Age-Friendly Shared Service, and I very much recognise the value of collaborative working to improve the health outcomes for older people. I think for so many years the common parlance was to refer to professionals as this working in silos thing, but hand on heart I have to say that the engagement between the local government sector and the health service has really developed and extended over particularly I suppose in the last couple of years. New structures have developed to work together on initiatives such as the Integrated Care Programme for Older People, Sláinte Care and Healthy Ireland, and more recently the Community Call, which I suppose was a national government initiative set up as a response to the pandemic. And I suppose the urgency of COVID and what everybody had to deal with, I think accelerated the joined up working in the interests of older people and indeed others in the community who were asked to stay at home, or that cocoon, which I think we all got to realise that older people didn't really like that word, cocoon. But in my capacity as Chief Executive, I chaired the Meath Community Response Forum, which we still have ongoing, although much less scale. And I really saw firsthand how agency and organisations across a range of sectors worked cooperatively and swiftly, I have to say, to deliver the supports that were needed during the emergency. And very much core to this was the Age Friendly programme and the members of the Strategic Age Friendly Alliance at local level. And there are many examples of where HSE funding in partnership with local government for the benefit of older people, one example being the digital services for nursing homes back in 2020. And indeed another critical example is the Healthy Age Friendly Homes programme, which we are currently rolling out, and that is really to support older people to age well in their own place and ultimately reduce early admission to residential care. But today we are launching the output of a collaborative process during an 18-month period. This legacy document captures the many wonderful initiatives delivered by the local age-friendly programmes, the HSE, the NGOs, community and volunteer groups, and indeed those in local government sector over the past 2 years. There's great learning in the report, I think, as Siobhan has said. It does set out loads of initiatives that I think in particular were actually valued by the older people themselves, and that has been documented extensively through a long consultation process, which I hope Kitty, who's here with us, Chair of the National Older People's Councils, will refer to. But I'm very pleased to say that these initiatives are now available also online in on our own Age Friendly Ireland website. And I think we'd all agree that models of good practice, however big or however small they are, need to be shared and scaled up or replicated, particularly where they have been proven to be very effective. So today is a great opportunity to reflect on all of those initiatives that supported older people throughout the pandemic. And this can help us indeed plan for future services for a very ageing population ahead. I want to express my thanks to the advisory group for this work and to the researchers, in particularly to Alice Corbett and Etna Mallon. They're very experienced age-friendly programme managers in their own areas, and I know they had the right skill set to facilitate the process. But I do also want to thank particularly the Older People's Council's members from across the entire country. Many of them had to sit on maybe even multiple sessions through focus groups and offer their own personal experiences and viewpoints on health and wellbeing initiatives. And I think that's really the kernel to this. We really, and this heard from the older people themselves, what personally affects them and what they want and what they hear. So again, look, I just want to reiterate that ongoing collaboration with the health service is hugely beneficial to ourselves in the local government sector, particularly in striving to support our communities in a very holistic way. We're very fortunate in County Meath that we have ongoing engagement from the health service at a local level at the Age Friendly Alliance. And I have to say that structure, for those of you who may not be aware, is repeated in all 31 local government sites. I suppose, in fact, the fact that local government actually hosts the age-friendly programme has given it full country coverage across all the administrative areas. And I suppose is one of the real reasons why the World Health Organization acknowledges Ireland as the first fully affiliated age-friendly country in the world. So cooperation across local government for the benefit of all its citizens is very much at the heart of what we do. Local government delivers many services that benefit from input and collaboration with the HSE, whether that be planning, housing, transport, and particularly community development. Opportunities to work together, as demonstrated today, enhance both of our organisations' capacity to deliver on our strategic objectives. So I very much look forward to our continued close working relationship with the HSE and indeed its parent department, the Department of Health. I too want to extend a sincere thanks particularly to Dr. Stephanie O'Keefe, who has been with the Age Friendly programme for a long time and who actually sits on the National Advisory Group, and indeed to Dr. Philip Crowley, Director of Strategy and Research, for the cooperation and work to date. I also want to acknowledge the Trojan work of the Steering Committee, who directed and supported this piece of work, and welcome that continued collaboration and I think good relationships and friendships that have resulted as from it. So look, finally, I do want to particularly express our gratitude to Des as well for all of the cooperation and engagement over a period of time, Des. We'd have been lost without you. But again, just to thank my own staff under the leadership of Catherine McGuigan and Sylvia and Ciara and all the girls who are here today to help put this together. And, you know, it's always those who work really hard to pull all this together and to make it possible. So to really thank you all very much, but well done to all. And again, I look forward to reading in detail the book of medicine, I think, that we have ahead of us now, and look forward to maybe, you know, increasing all of those initiatives and rolling them out further, you know, that make such a difference to the older people. So thank you all in all, and look forward to seeing you again.
Thank you very much, Jackie. So we've done a lot of talking about the document. So now I'm going to ask Etna Mallon, who was the external consultant who was engaged to go and do the engagement with older people and to hear about all of the different initiatives that took place right across the length and breadth of the country. And for all of us in this room and for everybody watching, you know, you're going to get a flavour of some of the initiatives that were started through this process. The value of what has been done will only be realised if we look to how we replicate what was good in Kildare, what was good in Sligo, what was good in Donegal, and bring it to our own areas. Because that's what this is about, and that's where we will really make a difference in the lives of older people. So Etna, thank you.
Morning, everybody, and morning to everybody that's out there, because we're still trying to come together by staying apart. My name, as Des says, is Etna Mallon, and I have, in my former life, I have been the age-friendly coordinator for Fingal County Council in a time when Paul Reid was our HSE, was our CE. Now you have him in the HSE. But I am going to spend some time talking about the actual project. So, I mean, I had intended to talk about the context, but I think Dr. Siobhan Nivreen has done that for me, so we won't labour on those kind of things. But I want to tell you, I'm going to actually look at this one here because I can't actually see the monitor there. I'm going to talk about the background of the project a little bit. I'm going to talk about the actual initiative, like what we were trying to do and what the Oversight Committee were asking of both Alice and myself. I'm going to talk about the methodology, what we did to try and achieve what we were doing. And I honestly want to talk about the breadth and array of initiatives that were done around the country. And, you know, there is not enough time in this day for me to go through all of those. So I've just picked a few of them that I think are actually incredible, some of which probably don't take any money. but just are worthwhile replicating around the country. And then I want to talk a little bit about the key learnings, because I think they're important, and they're based, everything that I have written in the document is based on consultation with older people. So I only reported what I heard, because that's what they asked me. So I'm going to talk a tiny bit about the background, because as Siobhan said, it is based on the fact that the HSE in November 2021 or 2020 recognised a need to focus specifically on older people, particularly around their health and well-being, particularly around their mental health and their loneliness and social isolation. So this project, through looking at the work of Siobhan Kennelly, threw up that these were people that needed, a specific attention. And cocooning, no more than COVID didn't cause so loneliness and social isolation, but it may have heightened the whole impetus. And then, at the input of Dr. Colm Henry, the establishment of the actual working group. And I probably would like to say as well that the partnership has been a great partnership, and working with the Oversight Committee has been an absolute privilege, and working with older people has been an absolute privilege. But I think I've always known, because I have spent time as an age-friendly coordinator, that consultation with older people is the very ethos of what it is that Age Friendly Ireland actually does. So it was an absolute privilege to be asked to come to this table and to be part of this project, because, my heart will always lie in listening to older people. So Alice and I are a joint team. We're a double act. I can't even see her at the moment. Oh, there she is down at the back. But we're a double act. So this project has been in two phases. So phase one was Alice, and phase two is me. So I'm just going to talk for both of us. But I took up the baton from Alice. So she did the hard work of commencing the project and establishing things and getting the older people together, and working with Sarah McCormick in particular, who at that stage was the chair of the committee, and actually consulting with older people and consulting with national policy leads in terms of the HSE. So Alice's piece of work, which was a huge tome of an inventory of the initiatives that were done, she handed that on to me, and I took up that baton and I took it forward as far as I could. So, Alice and myself are good colleagues and good friends, and so we were able to actually kind of seamlessly, I hope, to take the project on. So then when I came to the project, it was July 2021, and it was to see how we could advance what Alice had done and take it to the next level. So I was asked to do an analysis of a comparative exercise on all the initiatives that were done, in order to try and make sure that there were no gaps. And if there were gaps, I was going to go and try and find where those projects were and who those people were that I needed to talk to. I was also asked to support a consultation process with older people, to assess those initiatives that older people felt themselves that were the ones that they would like to see replicated around the country or rolled out, or further investigation to see if replication was possible. I was asked to, there is a wonderful online repository, and there was already evidence in that repository before Alice and I ever came to the table. So, Age Friendly Ireland had a repository. Our job was to actually make it as robust and as comprehensive as possible, so that when any service user, or even service, and particularly service providers, would then have access to a very valuable tool, so that they'd be able to look at those initiatives and try to replicate them elsewhere. And then I was asked by the HSE if I would review the resources for older people that they themselves had. So whatever material or ephemera that is out there that the HSE had in all of their CHO areas, we pulled together and put into one particular place, which is now a catalogue, which is up on the actual website as well. And it's a very valuable piece exercise insofar as, and I'm very thankful to all of the people in the CHO areas who gave me that information to put together in that catalogue. It's a piece of work that can be forever added to, so nobody is ever late. So if you didn't put anything in, you can put it in now. And also, if you want to make changes, that's possible too. And then I had the privilege of drafting the legacy document, but that was pulling together everything that older people told me, basically. So I did this by either doing some desktop research. So I looked at all the literature, both global, from the World Health Organization, national, and then local. And there was a lot of material out there, but it's important that, you know, that the level of material was reflected in the actual document. So I tried to do that as best as I could. I also wanted to make sure that I didn't leave anybody out, and that I didn't leave any kind of, you know, there were so many national programs that were rolled out that were extremely valuable during these very trying times. I did the review of all of the initiatives that were already collated, and then identified the gaps, and then the consultation process, because COVID obviously restricted how we normally would do our consultation process. And our normal consultation process, as Kitty will tell you, is, you know, a big room with a lot of tables and a lot of people and a lot of conversation, and very interesting conversation. But, you know, COVID didn't allow us to do those kind of things, and to some degree we were restricted by COVID. But we decided that we would do a questionnaire, and that we would, you know, feed it out through all of the representatives. The chairs of the National Network of Older People were very supportive to me in getting that out and about all around the country. We also decided that we would have focus group sessions, because we actually felt that we needed that in-depth personal conversation that you can have when you're sitting with people. And despite the fact that it was online, I still managed to have those kind of conversations. It blew me away, to be perfectly honest, that people were still prepared to have those conversations with you, even in a remote capacity. And then I had, because to some degree when you're talking to older people who are connected within the age-friendly family and the age-friendly community, you're talking to people who are joiner-uppers, that's what I call them, they're connected. So I thought it was really important to talk to those who are disconnected and not joiner-uppers, and who never join any organisation at all. So I held some over-the-phone interviews with people from around the country, so I'm very grateful to Limerick, to Kildare, to Dublin, and to Cavan, and to people who gave up their time. Oh, and to Laois. I cannot leave the gentleman out in Laois. There was just, again, I asked the same questions of the people that I asked in the focus groups, and I asked in the questionnaire. I took 2-hour phone calls at times to have conversations with people. So it was really important to hear what they had to say as well. So in terms of the questionnaire, I did a draft, and then I asked the National Network of Older People's Council if they had any members who would like to take the actual questionnaire and to follow through and see whether it stood the test of time, or whether they thought I had left things out. Believe you me, I was told quite quickly what it was that I had left out and what it was that I should put in. And I'm really grateful to 3 gentlemen in particular: Richard from Waterford, Bob from Cavan, and Brendan from Fingal, because they gave it their time and their input, and I feel that we got the best in terms of a questionnaire. And then I asked the National Network, and they pushed it out to all its members. And while the numbers are not huge, that's probably because, again, they were very busy in their own bubbles, doing their own thing. And so we had 89 responses, but that still it's a snapshot in time of what people actually were going through. The focus group sessions had a dual function, so we had 2 2-hour sessions. And again, I mean, I have to thank both Alice, who, while she sort of handed the baton over to me, continued to give me her expertise in terms of facilitation, and Louise Edmonds, who's also a regional programme manager, and both of them supported me to actually allow the older people in the sessions to have their say. And the function was to have their say about the 5 key themes: staying active, staying connected, eating well, managing your mood, and there's one I'm missing. Switching off and being creative. And the other was was to assess the initiatives from around the country to see which ones that they actually felt that they wanted. So we had an online poll. So again, thanks to Ciara McManus, who did all of the administration behind the actual scenes. And we had an online poll, and it was great fun and great crack, and we managed to get the whole process done. The over-the-phone interviews, as I said to you, were very intimate. They were two ladies, two friends from Dublin 10, and a gentleman from Laois, a couple from Kildare, and again, I'm missing somebody, but it'll come to me. Oh, Limerick, the lady in Limerick. And they were very personal conversations, and they were very wonderful conversations. And so that feedback about, we didn't get to go to the shops anymore, because in some cases, that's what older people do for exercise. And either they go to mass or they go to the shops. And when cocooning came, that stopped them. However, on the other hand, it is the resilience and the fortitude of older people that never ceases to amaze me. Because in the absence of being able to go to mass and in the absence of being able to go to the shops, they took to walking in their own local parks. And I really think that the designated times in the parks was a huge asset, a huge way of doing things for older people, because they felt there was safety in knowing that when they went out, it was other older people that they were meeting at those times. So they got to see their friends, or at least that's what they told me. These are some of the things that came up in consultation. It came up in the questionnaire, came up in the focus groups, and came up in the over-the-phone interviews. So 2/3 of the people that we spoke to in any way, shape or form continued to walk. And the funny thing is, I honestly think that the raising of awareness of people through television, through the message that was being pushed out by the HSE, by the Department of Health, by the government about the importance of getting exercise even when you're cocooning, whether it was walking up and down the stairs in your own house, whether it was walking around your garden, whether it was any of those things, it hit home. So it's important to remember that actually those awareness campaigns do actually work. Those, you might not have realised that you were actually reinforcing the message, but we were, basically. Under half availed of online classes. Now, again, we are talking to people, particularly when you're talking to the National Network of Older People's Councils, you're talking to people who are connected online. So they are the fortunate people who, at the same time, those I spoke to over the phone or in the focus group sessions took to walking, and they took their inspiration from that gentleman in England, the Major or the Captain, Tom, and they figured, well, if he can walk around his garden at the age that he is, I can walk around my garden, or I can walk it up and down the stairs in my home. And that's where they took that's what they told me, okay? And as I said, many discovered the local amenities. And I can tell you, the two women in Dublin 10 told me that they found their local park and they hadn't been in it since their kids were small. And one of them is 89 and the other one is 87. So finding your local amenities, and in the focus groups, people felt that they were given a new sense of what they had in their community. And I think to some degree that local authorities need to maximise that. The fact is, people found what they had close to home. In terms of staying connected, the majority, 90% of the people on the questionnaire and all of the people in terms of focus group and over the phone said their phone was their lifeline. Their phone was what they used to stay in touch with their families. Their phone was what they used to stay in touch with their communities. On the other hand, all of them, while they may not all use technology, they recognised the value. And certainly I know from the National Older People's Council, they knew that it enabled them to stay in touch with each other. They knew it enabled them to continue to have their meetings. And while, yes, we're all Zoomed out, we're all Teamed out, Zoomed out, WhatsApped out and everything else, the fact of the matter is we embraced it. And we had this conversation earlier, Sandra and myself and Dervla, and the fact is technology has... It forced us to change, COVID forced us to change the way we see things, the way we do things, and how we adapted, how quickly we adapted. So technology certainly was the tool that actually helped us to stay connected to our clients, stay connected to our communities. So it has been, has played a huge part in what we've had to do. 2/3 of respondents said they read more, but they are a group of people who have always been good readers. And don't rely on technology to read, just rely on the newspapers and the magazines, and Ireland's Own in particular, they love. And then in the focus group session, and that whole cocooning and marooning, I mean, there was just some wonderful conversations. But some people took to writing poetry, and some people, and it's not just what they did to stay creative themselves, it's the altruism of what they did. I mean, the gentleman, Bob, who actually wrote poetry, then sold his book of poetry, and a percentage of which he's donating to the Alzheimer's Society. So it was the huge altruism that, that they were applying. So older people are prepared, like what they were doing was trying to use their opportunity to look out for themselves and to do something for themselves, but also double whammy, trying to find another way that they can actually make it of benefit to somebody else. So there was another gentleman who was finding himself probably going downhill in terms of his mood, and so he decided to offer his services as a driver for the emergency food to get to other more vulnerable people. So he found a way to continue to be active himself. So it's the altruism that actually blew me away, to be quite honest. All of these things you can see in the actual report for yourself, so I won't labour too long on them. But just to say that there definitely, in terms of managing your mood, there definitely was a level of anxiety, and there was a level of anxiety for all of us. But the level of anxiety for older people, and one gentleman in one of the focus groups actually even said that 2 years lost in an older person's life is a long time to lose. When you're younger, 2 years just seems like 2 months, but 2 years as an 86-year-old means you're 88. Like it is a big chunk of your life. Anyway, I'll move on, and just to give you an idea of the breadth and array of the age-friendly initiatives. And it was the In This Together and Keep Well campaigns. They just kind of focused our attentions and focused our direction on where we wanted to go. The On Post, coming together while staying apart. And I mean, the postcards. I mean, lots of people took those postcards and sent them to people that they probably hadn't talked to and hadn't written to, around the country. So, I mean, it was a wonderful project. The GAA and League of Ireland, it's good to talk, because that was just one man in the GAA, and it was a huge, again, altruistic thing for him to do, to spend time talking to people who are obviously fans of GAA. And then that baton was taken up by Conan Byrne, who is League of Ireland, and he had 100 people, both coaches and players and managers, who were prepared to talk soccer to their fans. And the fact is, some of those players or retired players are still talking to the people because they have found now a friendship in terms of talking to them. And that's I think that it's good to talk with, Sporting Ireland and the GAA and League of Ireland is something that can easily be done particularly with local development companies or community resource, where they can do the coordination, and then the players and the managers can just do the talking, because the hard part is the coordination piece in the middle. The local authorities community response team, everybody that I talked to, all of the older people loved those. The fact that the community response team put the right person in their, in their space when they needed it straight away. And so very definitely they would like to see the community response teams continue. Those structures seem to work really well. On Garda Síochána, again, people couldn't thank them enough for the care and attention that they paid to older people in their communities. And the fact that they took some people to hospital appointments when they couldn't go on public transport or in taxis. Or in terms of local initiatives, I have to say that I was blown away by the smart technology projects in both Cork and Tipperary, because again, see, the important thing to remember when you're doing initiatives for any of us is that, if you put the right people at the table together, you can get a great project. You know, so we all have different skill sets, we all have different things to bring to the table. And in the case of Tipperary and Cork, they recognise that very quickly. So between the Education and Training Board and the HSE and and the local authorities themselves, they all brought what they had to the table. And then they added the ambassadors, the digital ambassadors, so they have peer support for older people. So they have the devices, they put them out there, but they gave all the training was provided, and the backup support in terms of ambassadors is all being provided as well. Because I know I'm kind of taking up too much time, the Cavan Meals on Wheels, I think, is a huge one that needs to be looked at in terms of how to deliver Meals on Wheels going forward. Because, again, volunteerism needs to be supported. And I think what we realised in terms of cocooning was that an awful lot of older volunteers deliver Meals on Wheels. And when cocooning came, the Meals on Wheels suffered as a result of it. Now, it very quickly was replaced by people who were on furlough, and they had time and they actually gave of their time, so that did work. But I do think that there is room to learn from local development companies working with volunteers to deliver Meals on Wheels. I honestly do. I genuinely feel that myself. And the other one that came to the top was the COVID notebooks from Kildare. That was just such a lovely project, really lovely. And it's also a wonderful example of social history and a wonderful example of where it will actually be held in the library service in terms of archived as to what people went through or felt they were doing during their time in terms of COVID. These are the initiatives. In the focus group session, as I said, we assessed, we had 5, well, Alice and I had probably got about 12 focus group sessions. And that's not even including the sessions that we had with national policy leads or programme managers or Healthy Ireland programme managers or regional programme managers. That's just focus group sessions with older people. So we did a lot of consulting with older people, and so we hope we captured their voice in that way. But again, you'll see that from the initiatives that are highlighted, that it is all about the radio. Radio is our thing. And exercise programs that were over the phone or even over, that were interpersonal are the way they want to go. So the Age and Opportunities Fit Line was a hugely successful program in terms of it being still, it was the phone call. It was the every fortnight phone call from the person that kept some people going, and not even necessarily the exercise. I've mentioned some of these, so you'll see them for yourself. The Irish Hospice Foundation, the bereavement support line. Lots of people lost lots of friends in that time. So not being able to grieve for, or to actually, do our usual, our wakes and our, being there for families was very difficult. So that bereavement line was very important, but it needed to be highlighted more. So what have we learned? We've learned that we need to use radio more. We definitely need, even if it's just about awareness, local radio is big. And the radio is very important in an older person's life. We need to, there were wonderful projects like the Galway's Helping Hands, but that's a bit like care and repair. It's a bit like the practical things that older people need us to be doing to help them to stay in their own homes. We need to repeat some of the wonderful things that were done by the HSE in terms of the healthy food tips and about nutrition, but it can be done over the radio too. This is all available on the website, so I don't need to go on too much about everything because it's searchable under initiatives. You can search the database. The information that's on that database is only as good as the people who keep updating it. So we will be relying on programme managers and regional programme managers and HSE area teams to actually keep the work up to date. It also, the website also includes the HSE resources, again, only as good as the people updating it, but a really important tool. All of these are really important tools. So, challenges. The social isolation and loneliness won't go away. The fact of the matter is we have been really good at being specific and focusing. And honestly, older people have asked that we continue to look at how we can do this with them. Because some of these initiatives can be rolled out and will be, and I actually genuinely feel that the GAA and League of Ireland can help in terms of that kind of work. We need to develop and maintain the age-friendly initiatives and the resource, so that's me harping on about people updating the stuff. The level of what we have learned is that collaboration, coordination, determination from all agencies works, so that collaboration is a huge asset. And supporting it'll be really important to support the positive mental health and well-being of older people as we come out of COVID. A couple of people mentioned that they were struggling to come out the other side. And not, all of a sudden here we are, we're allowed to be out here and we don't know whether we can shake hands, we don't know whether to put a mask on or take it off. And some of these people, one gentleman in Wexford told me that he always went to the pub on a Sunday with 7 friends. There's only, I think, 4 of them left. So the impact of that is huge on people. And then my bugbear at the end is maintaining the Meals on Wheels, because it's a huge asset within the community. I would like to thank the National Network of Older People's Councils. I would like to thank the people who took the time out in terms of being in the focus group and the level, I mean, I cried sometimes. Both tears of joy, because their resilience and their fortitude astounds me. And also tears of sadness in terms of all that they felt that they had lost. But at no time did they feel, they weren't feeling sad, they were just feeling you just get on with it. That's what you do, you just get on with it. The age-friendly regional managers and programme managers, the HSE-CHO area people who gave up their time, and then the NGOs who heard me over the phone and gave me all the information. So thank you very much for your time. I think actually we're going to see a video now of some of the initiatives. Sorry.
COVID-19 has been a time of immense challenge, immense loss and immense grief for all of us. But it has also been a time of great innovation and great solidarity, where as a country, as individuals, as groups and as organisations, we came together in very innovative ways to make sure that no one person was left behind. This video gives a short snapshot of some of the examples of real innovation that happened in services around the country to support older people.
Now I've a daughter of my own.
COVID Care Concerts was an initiative dreamt up by Gerald Peregrine, and the idea was to bring high quality classical music to those most affected during the pandemic. It was funded by Creative Ireland and Age Friendly Ireland and ran right through to February 2022. I remember one particular concert where a lady who was visiting her mother in the nursing home approached us and asked if the musicians would sing a song for her mother, who was extremely unwell and unable to attend the concert. So when the concert was over, the musicians, all 4 of them, approached her door, her window, and they performed directly to her and her family. And that was particularly special. And we were all in floods of tears.
As you will know, staying healthy as you get older is very important, and that was more pronounced in COVID than it ever was. And here in Sligo, we ran a virtual cooking programme with Eiling, which incorporated over 55 people cooking through Zoom. So it was very nutritious, quick, easy meals. And it was also about not having to go out and stockpile your cupboard with things you're never going to use again. It was about looking at what you have and using what you have to utilise a nutritious, healthy meal. And also cooking maybe for 2 days. But the big thing as well was that people actually were connected and could see each other. And I suppose the negative was you couldn't taste the food, but people would describe the smells, they would describe the flavour. Sometimes people might eat before the end of the programme, if you want to call it a programme. But it was very enjoyable and people gained a lot. And also they have sustained that and remained friends.
Lovely. Oh, wow.
In CL Blue Ireland, we deliver physical activity programmes to Ireland's older population, those living with physical or intellectual disabilities, or chronic diseases. In 2020, we went from working with 6,500 people a week to 0 people as the COVID restrictions came into force. So on the 16th of March, we started delivering programs online via Facebook and YouTube. And what we found was that it quickly built an online community of people who were joining our sessions at 11 a.m. and 2 p.m. every day. And throughout lockdown and throughout the cocooning period, it was giving people structure on their days. Physical activity for our older person helps people to maintain their strength, their agility, their aerobic endurance, which in turn slows down the ageing process and allows people to maintain their independence and in turn live at home for longer. There were over 800,000 views of our sessions online throughout the lockdown period. So for us moving forward, this will be an integral part of our programme.
We had a very successful Living Well programme face-to-face, and once COVID hit, we quickly realised that we had to convert this programme online. I would say about 50% of our vulnerable adults were not able to get online to get onto our programme, had no technology, no devices and no internet. The programme went online and we decided that we would have a device library for people who didn't have their own devices. We worked with Age Friendly Ireland on a very easy way on getting online to Zoom or WebEx, and then with the support of a device that had a built-in internet and had built-in easy to use features. There was 1 or 2 steps and you were in on a programme, made it very easy for people to get online. This woman had been bedbound for 6 months at this stage due to her illness and was out walking around the front garden because she had the device to be able to get up on a programme that would help her progress with her condition and be able to have a good quality of life and more confidence. And without that device, that woman would still be in bed, would still be very much bedbound because she would never have been able to attend a face-to-face programme.
We were looking at ways to engage older people and people that were cocooning. And one of the ways that we did that in Kildare County Council was to ask people to take one of these notebooks. It was being delivered to their home, to take this notebook and to write down or record their experiences of COVID-19. And our aim for this project was that we would create an archive for the county. So there will be a digital archive of these notebooks for years to come. There's holy medals and newspaper cuttings and receipts, all sorts of things that tell something about a certain time. And I think a notebook is very precious and it's something, almost an heirloom, a live heirloom I suppose. So I think there's lots of scope for this to be adapted by lots of different groups all around the country.
As you can see, a fantastic array of initiatives that have been rolled out in partnership with the HSE for older people throughout the pandemic and post-pandemic. Age Friendly Ireland are delighted to be working on this partnership with the HSE, as we have done over the last decade, but particularly on this piece of work where we have produced a fantastic online repository on the Age Friendly Ireland website where you can look up and hear more about all these fantastic initiatives and the models that worked, and also a legacy document that we're producing which is capturing those. But what is important now as we move forward is that we harness those relationships and those projects that have been led out across all the sectors, and that we really look at the meaningful impact they have had and progress them as we move forward. We are delighted that this piece of work has progressed.
So just a very short snapshot there of the wonderful initiatives that are taking place across the length and breadth of the country, and all of them with a focus of health and well-being, and like I said earlier on, that lifestyle medicine piece. In no ways to detract from all of the operational pieces that went on across the HSE and other agencies right across the country, but this was a particular focus on health and well-being and lifestyle medicine, and everybody who took their time to contribute to this has to be commended. It's just a gorgeous piece of film with some really nice examples. So all of this work, it doesn't happen without a sponsor. And we have been very lucky in this piece of work that the Health and Wellbeing Division and Philip Crowley, who's here with us today, sponsored this and took it on and said, this is an important piece of work that needs to be carried out as we exit the pandemic, as we exit COVID-19, and we take this legacy and we look at how Ireland responded to a global pandemic. And examples there, like the diaries in Kildare, I think it's such a beautiful piece that is there forevermore. That's just this gorgeous archive that will, in generations to come, people will read this and go, oh, God, my granny lived through that, or whatever. Just a really, really nice piece. So everything we've heard from Etna, everything we've heard from everybody else is that all of this has been dependent on the voice of the older person. And we are delighted that Kitty Hughes has given her time to come to us today and be present and talk about her experience, one as an older person, but also as a member of our Older Persons Council. And it has been, there's been a lot of preparation, and it's a big commitment to come here today and speak in front of you all. So please put your hands together for a warm welcome for Kitty.
Dear Smear Yves Kildare, it's wonderful to be here among real people. That was the first thing I have to say this morning. I met real people. They weren't in a little square on my screen. And I want to say thank you very much for inviting me as chair of the National Network of Older People's Council to this launch of the HSE and Age Friendly Ireland legacy document, Ireland's response to older people during COVID-19. Etna, you are just marvellous. Absolutely, all the work she has done, and with Alice, well done. Thank you very much. Congratulations. The background noise you'll hear is my heart thumping, but anyway, I'll keep going. At this stage in the pandemic, we are daring to hope again that normality is just around the corner. And it's good to have that you have your eyes on the future as you learn from the last 2 years of fighting the COVID-19 pandemic. Because history has its eyes on us, as Amanda Gorman said prophetically just a year ago in January 2021. And she continued on, how could we possibly prevail over catastrophe? Etna has shown some of the ways we did it. Well, it's an old but true saying that we must learn from history or we are bound to repeat it. Good health, according to the World Health Organization, is a state of complete mental, social and physical well-being, and not merely the absence of disease or infirmity. But for 2 years now, a whole new way of life has emerged thanks to the spread of a tiny coronavirus which has caused this global pandemic. And out of this, a new normal has dawned for each of us. So it is just wonderful that Dr. Colm Henry and his Health and Wellbeing Working Group and his representative here today, Dr. Siobhan Ní and Etna and Alice, that they have done this wonderful work, that they have looked back, analysed, consulted and reviewed how we have coped, or not indeed, with this pandemic and all its consequences in our daily lives, and in particular its impact on older people. I thought I'd check out my diary and some notes and pieces that I'd written back in 2021 and 2020, and maybe share a view from my experiences of living alone in rural County Longford. So, I've written December 2020. We have suddenly been exposed to problems we had never seen before. We've become aware of new risks. There are new constraints and restrictions on how we live, work and play. There's a whole new set of perspectives on how to keep the family safe, run a business and use technology. We don't socialise anymore, we self-isolate and social distance. I now know precisely how far away 2 meters is. I've lived in a cocoon all spring, and then all summer and autumn I was in a social bubble and a pod. But I was not alone at home. Dr. Tony Holohan, Professor Luke O'Neill took up residence in the corner of my living room, speaking to us about preventative measures. And then we had this mesmerizing army of medical experts epidemiologists, statisticians warning us of the dire consequences of breaking the lockdown. Now, we're very law-abiding people when you come to my age. And so I move on in my diary here to the 5th of February 2021. Lockdown level 5, a note from the bubble, it says, old age is coming at a really bad time. You know, it's important not to discard or segregate the older people from our society, but to have them be a vital part of our lives. And so we had a hunger for live experiences, of being in the moment and not watching a replay of the highlights. We wanted to intermingle in a new environment with the different energies that stimulates our bodies and minds. But we were at home, staring out the window, watching screens, Zooming and texting. And we took the car out to make sure it would start, but really it was to make sure the world was still out there. But we were very patient. We were in a state of patient resignation. I had a bit of an emergency myself during the pandemic. I needed expert help when a drain got blocked. Now, when you're on your own and when you walk out the back door and everything from the washing machine is there looking at you, that's an emergency. And then I remembered Longford Community Call. So I got the phone number. That was on Age Friendly Ireland Daily Newspaper, their newsletter. They're not called Friendly for nothing. They know what's needed. And it was a godsend in terms of information in simple terms. Now, that newsletter also celebrated all the good work that was going on around the country, and was very practical in terms of giving information and telephone numbers and supports to help us during lockdown. Anyway, I got the phone number. A friendly and efficient lady answered, not only gave me the information I required, but a second phone number in case the first one didn't work. And it all worked out fine, and I'd like to thank her, and indeed the local firm that came to my rescue. Great efficiency and courtesy. So everything was grand again. And indeed, I want to thank everyone who answered our calls for help, assistance, advice, and support during the pandemic. Of course, the doctors and the nurses who worked 24/7 in our hospitals, they were our heroes. Day after day, there were others too who were very good to us, our good neighbours and caring families. And then there were people like the postman. Not only delivered letters, but tapped on the window to wave hello, to ask if we needed anything. My letters were posted, and he brought me supplies of stamps when I needed them. I think the postmen and women should get a medal for all the care way above and beyond the call of duty that they showed during the pandemic. Another group was, and indeed Etna has referred to them too, the community Gardaí. And they had a list of older people, and they phoned and they called to the house. Now, one sunny day I was out in the garden and the patrol car drove in, and there was the sergeant, and he hopped out, and "How are you, Kitty?" he said, and he was just calling around. And when I got over the shock and everything, I was delighted to see him. It was a real human person, and we chatted at a very safe distance, and he drove off again. But he had been seen. And there was a phone call from my neighbour to know was I all right, that there was a patrol car seen at the house. So there you are, the network was working. So I slowly learned to shop online, to book a delivery and add to cart, no less. And then the delivery men were prompt and friendly, but they had no time for a chat, and a cup of tea was totally out of the question. But still, he was a real human and very welcome. But of course, not all our needs come from the supermarket shelf. And right now, we're patiently resigned, as I said, this is from my diary, to our fate. We stay at home, we keep our distance. And if we get the vaccine and the lockdown is lifted, we'll be ready to rejoin society with energy and enthusiasm. There was help. There was help at all times, as I say. There was the community forum It was an excellent idea, and every month our Chief Executive, Paddy Bahan, chaired the meeting online, and we had representatives from the local authority services and the various voluntary groups attended. And I was invited to come along and speak and keep them informed on the needs and news of the older people within our county, that's County Longford. And it worked a treat, especially when we had the representative Joe Rowan, who came each time from the HSE. Now, we wanted to know about the vaccine, and we wanted to know about the rollout, and we wanted it now. Such excitement and gratitude when we got that first jab, and then the bigger rollout in all the centres in our local areas. And the news that I got, I shared with the Older People Council members immediately, and that was a real ray of hope. And then the actual vaccine rollout, that was a massive task and managed with such efficiency as the local sports centre became the centre for vaccination in our area. Volunteers and professionals worked with first-class efficiency, catering for every need and age group, generating hope and a great sense of well-being as you walked away with your COVID cert in your hand. We certainly had turned a corner. And of course, and as Etna pointed out, by now the digital age had caught up with us all. Well, as I have to admit, as an older person, we caught up with it. Already, even our homes have changed. People are working from home, or is that living at work? It's hard to tell sometimes. Online technology allowed us to be anywhere and still be connected. Older People's Councils even found a new way of meeting on Zoom. And the volume of consultation we were involved in, the fuel allowance, work with Comreg, and indeed with AIR, and we even got our own line as a result of that, age-friendly care from AIR, the Pensions Commission, all progressed despite of restrictions. And our own in Longford, the library, put up a myriad of information online. There was the borrow box, through which you could access even the daily newspaper. There was a digital skills course. It certainly helped many older people make full and better use of the information that was available online, and was there information available online. Everything from diet and exercise to health and hobbies, history and gardening. Gardening was great. They sent us out these packs. So I sowed the seeds and everything else, and it was doing grand. My carrots came up, and I said, gosh, they should be in a bigger thing. I better plant them out. My brother said, you don't plant carrots. I said, I have to. I did. The results would make interesting exhibition pieces in the Tate Modern. But they tasted grand. So, of course, not everyone embraced digital life. And as time went on, there was a heightened awareness of the needs and impact of the pandemic on older people, and how to balance care and the prevention of contagion with the needs and the necessity of social interaction. That was a difficult task. Dr. Catherine Mannix, in her book Listen, she found out that medicine was not the total answer. She said, when a patient didn't improve as she expected, it turns out I knew what was the matter with my patient, but not what mattered to her. Indeed, we all need to listen to each other. When I even is replaced with we, even illness becomes wellness. And we're not all the same. And who decides what being old is? Bob Hope, now he'd be a bit before all of your time, he was describing a lady that he admired to a friend. What age is she? Asked his pal. Hard to tell, said Bob. She said she was approaching 40. I couldn't help wondering from which direction. Well, good on her, I say. Most people, as they age, are able, capable, and very willing to be generous contributors to life in their community. We can't help getting older. I know all you young people down there and all you young people on screen, you will know that you're getting older when it's the doctor and not the guard that tells you to slow down. Over the last year or so, our national network of Older People's Councils have participated in workshops with the Health and Wellbeing Programme Manager And I hope that all these key findings from these consultations that Etna has so well outlined for you will be considered for future planning for services for older people. So this document today, this legacy, is really for all of you people going forward, not me. Because as you are now, so once was I. And as I am now, so you shall be. So I congratulate all of you on this wonderful document, and I wish you great success in all your good work. And may you all live to be 100. Gurmagin.
Kitty, thank you for so eloquently and so articulately putting to us online and in person here the human story of what it was to live through COVID-19 as an older person. A búlabus. I'd like to call on Dr. Philip Crowley now to give us his closing remarks, and then we'll call the event to a close. Thank you, Philip.
Thank you very much, Des. You know, when you're involved in an event, the one thing you've really got to avoid is following somebody like Kitty. So I have to have some words with the organisers. I'd far prefer to have gone before her. Impossible to follow, really wonderful. Thank you so much. And the video as well, very moving, I have to say. I'm now, since last June, I've been responsible for health and wellbeing in the HSE. Well, I'm not directly responsible, Helen Dealey is and Sarah who do all the work. But I love it being in my space. But it comes with certain responsibilities, and despite the lashing rain, I had to cycle out from Rathmines today, because if you don't live it, you lose the respect of Helen and Sarah, so that's not going to happen. And when I arrived, instead of having a cup of coffee, I ate an orange, which wouldn't be my normal thing either. So I'm definitely trying to take it seriously. So it's interesting though what you say, Kitty, about we will be you or you will be. I think we're all already each other, really. In the end of the day, I was offered a concessionary ticket for an art gallery the other day, and I toyed with the idea of turning it down, but it was far too good an offer to refuse. But all of this really is about partnership, and I think we have a responsibility to enter partnerships as organisations, because we're paid for by the taxpayer ultimately. We have a responsibility to the people of Ireland to work together and not to compete. Some of the old ways of working have been really poor, I feel, and I think certainly in the HSE we're very aware of the power of partnership and the power that we can bring to a partnership as well. We have a very large workforce, a very large reach in our population. We have an enormous amount of contact with our population. And with that comes, I think, a very significant responsibility to do a lot more than just deliver healthcare. We have to get serious about prevention, and I do think it's interesting that Des, you couldn't get past a conversation with Sarah without discussing lifestyle medicine. She's doing a presentation this evening on this course we're both doing. We're rabbiting on about lifestyle medicine to anybody who listen. But it is, and I actually have to say she's doing better in the course than me. She got better marks in the Christmas exam, so I'm a little bit miffed about that. But that aside, what we are learning about is the science behind what we all know is true anyway. But there's a massive scientific basis to the 6 pillars of lifestyle medicine, which interestingly fit onto the 5 areas very, very neatly. 6 pillars being diet, exercise. And when you say a number, it's very dangerous when you're giving a talk. You say there's 3 things I want to say, and when you get to the 3rd, you realise you've forgotten it. But there are 6 pillars. I hopefully should be able to remember them, having been studying it for some time. But diet, exercise, social connectedness. I mean, that's something that's really central to what we're talking about today. Stress, managing stress. Using substances sensibly, and then sleep. Sleep is absolutely critical, and we must look after our sleep, and we must sleep properly. So we hope as an organisation to really get even more serious than we already have been around health and well-being. We're starting to see proper investment coming into it, thanks to the work of Helen, Sarah, and Dervin and others. And we must do a lot more, though. We have to invest a whole lot more in this space, because so much of the disease that we spend our time treating is entirely preventable. So it's absolutely crazy economics to be spending the money after the horse has bolted. So we hope to be able to mobilise some of the science that we're learning about to really convince everybody else that what everybody in this room knows is true is acted on. So they've been 2 very, very hard years for everybody. I wouldn't single out any sector in society particularly, but obviously today we are talking about the impact on older people. And the concept of cocooning was kind of like, I think it was kind of a trendy kind of term because the film Cocoon, which I actually quite enjoyed, was these older people that interact with some aliens. And unfortunately we couldn't organise that during the pandemic, but I think that's how it kind of got a bit of kind of currency. But in the end of the day, it didn't work terribly well for older people. And I think, the long-term impact of this pandemic on everybody in terms of stress, in terms of social reconnection, in terms of, loneliness and isolation is really bad for your health. So I think I think some of what we've learned about what's been done over the last while, and some of it I've learned for the first time, is just fantastic. So older people are clearly at the centre of all of this, as is right, and they should be at the centre of all our lives in so many ways. There's so much to teach us. I think the current generation of older people, my mother was a member of them and my father too before they passed, are a kind of an exemplary generation in many ways, I feel, in Ireland. They've transitioned with the transition in Ireland. They've managed that transition into a more open, welcoming society. They've been strong and resilient during this pandemic. They've been wonderful parents and grandparents, and we should be very, very proud of them. Finally, I'd just like to say thanks to Des, to Catherine, to Sarah, to Kitty, to Ethna and Alice, and obviously Kitty's talk was just absolutely brilliant. You really should go into public speaking as a full-time kind of activity. You probably don't have time for it, but lastly, I'd just like to say that really, in some ways, having grown up in Ireland, I'm 61 now, so I've grown up through various aspects of Irish history, if you like. I wasn't always proud of Ireland. In many ways, I think this shows us the very best of Ireland, and I'm very, very proud of it. So I really hope that the HSE goes forward and fulfills its national responsibility in partnership with Age Friendly Ireland and in partnership with local authorities, and really plays its part to create a better and more healthy society. Thank you very much.
So, thank you, Philip. And all that's left for me to do is really call the proceedings today to a close. For all of us, just remember that all of these resources are online on the Age Friendly website, and please do look at them and utilise them and keep them updated, and let's live the dream of what has been presented here today. I want to thank everybody involved in the organisation of the event, all of our speakers today, all of the members of the working group, every older person who has contributed to what was presented here today. It has just been remarkable. And with that, I'd like to call it to a close. There are refreshments for those of us who are here in the room. For those of you online, I'm very sorry. You can't even smell it or whatever, but there it is. So thank you very much, everyone.